Greetings from Colombo. Welcome for this is Public Health podcasting series on success stories of public health in Sri Lanka. So today we are going to interview an eminent public health specialist and a leader in public health in Sri Lanka, and also WHO, World Health Organization's leader, and also advisor for government of Sri Lanka, and country representative of WHO in India, and several other positions, including Director General WHO's Special Envoy for COVID-19 pandemic preparedness and awareness for Southeast Asian region during COVID-19 pandemic. Dr. Palitha Abeykoon is very experienced person in public health in Sri Lanka. He had several posts in the Ministry of Health, and he was the President of Sri Lanka Medical Association, President of Sri Lanka Medical Council, and he was the chairperson of the Sri Lanka National Authority for Tobacco and Alcohol Control. And internationally, he was renowned for several programs like introducing medical college in Nepal and also in Indonesia. And he is the key person for success stories of eradicating polio in India. When he was the country representative for WHO in India, he said that during the time they succeeded in the eradication of polio. So we are welcoming to this interview. We are very pleasure to have you.
Thank you.
As a resource person for this interview. Sir,
I must first thank you for that extra generous introduction, which many of those things may be true, but not to the level that you mentioned. Anyway, thank you very much.
So Sri Lanka's epidemiological transition over the past 4 decades, I think so, marked by steady rise in non-communicable diseases, especially through the tobacco and harmful alcohol usage. It's an emerging modifiable risk factor and contributing to cardiovascular diseases and cancer, chronic respiratory illnesses, and liver diseases. So while Sri Lanka has enacted a strong legislation, especially to WHO framework convention on tobacco and control. So from your experience, in national policy, as you are the leader for that, developing that, and also global health governance, how should alcohol and tobacco control be strategically positioned within Sri Lanka's broader aspects of public health architecture to ensure long-term political commitment, institutional ownership, and intergenerational impact? So please, sir, first tell about what we have achieved through this and how we can move forward.
We will go from one stage to the other. Maybe the best thing may be, Dinesh, I'll give you a historical perspective and see how we got here to where we are now. Where do we stand inside and where do we stand in relation to the neighborhood, our countries in the region, and where we stand in relation to the global picture. I'll just give a little bit of an overview, then we can go into some details. Now, to start more or less from the beginning, when I say beginning, where tobacco story begins, actually Sri Lanka is one of the early starters in relation to tobacco and alcohol control. This was actually at the end of the turn of the last century. Sri Lanka had a committee which was looking at alcohol and tobacco. Long before the WHO thought of the Framework Convention, the FCTC, which followed in 2006, 2005. We had a president who was very positive about it, Madam Chandrika Kumaratunga. We had some very good sort of strong people like Mulkot Gunasekara, supported by Nalaka Mendis. They were very strong advocates of tobacco and alcohol control. Carlo Fonseca was one of the big names at that time. I was not here, I was in the WHO at that time. Now, we had in Sri Lanka almost got a bill ready on tobacco and alcohol. by about 2000, 2001. But due to lots of interference by the companies, by the industry, which is the normal thing, the commercial determinants that you are now very familiar with, they actually blocked the thing and got it delayed. Then around the same time, in the early 2000, the first decade of 2000, the WHO got the idea that we should do something globally for tobacco, not for alcohol. Tobacco, and then they initiated this thing, got a few resolutions passed in the assembly, but a resolution in the assembly does not mean it's not law. So we had to get a few countries to sponsor it, and the countries which sponsored it most of all very strongly: South Africa, Brazil, Australia was part of it. Sri Lanka also helped it all along. We were also in the first round of discussions with regard to developing a global or international law for tobacco control. And there again the tobacco industry interfered here and there, but the countries were very strong. And in 2005, the Assembly adopted what is called the Framework Convention on Tobacco Control, which is referred to as FCTC. That is in fact the first international law. That's the first ever international public health law. All the other things that the WHO does and adopts as resolution, they are only resolutions. They are not binding. But a law means it is applicable. But for a law to come into force, at that time, about 45 countries had to endorse it. And minimum 45 countries, but ultimately now, of course, practically all the countries, 193, all have endorsed it, except I think Indonesia and 2 other countries which are very strongly influenced by the tobacco company. So we were the first in the region to ratify this, and we were the 4th in the world. Norway, Brazil, and 2 other countries. They were Norway, Brazil. Anyway, I can't remember the country, but we were the 4th. So we have a good track record. First, we were on our own trying to go in the same direction. Then we influenced the FCTC development. We helped in it. Actually, this lady, the lady who was handling the subject in the ministry at that time, was one Dr. Lakshmi Somathunga.
Yes, DDG was there.
Now she's retired. Yes. She was also quite active in the meetings, I remember, And later, of course, she carried on that work in the country before the NATA came. The NATA actually was established by an Act of Parliament in 2006, and famous Professor Carlo Fonseca was the first chairman of that. But Carlo, and his strength was that he was very well known. He was an excellent communicator. He could move an audience with his oratory, and multiple talented man, I used to call him a polymath. He did the best he could, but the tobacco control and alcohol control did not go very far. They were moving slowly, but it was not very smooth. And the other thing you got to remember, that is in Sri Lanka, FCTC only controls the tobacco. Sri Lanka is the only country in the world which passed equivalent law to the FCTC, which included alcohol. Now,
not only smoking and also
not only tobacco, alcohol also. Now, it is a difficult situation when you have tobacco and alcohol in one. In a way, for us, it is good because both are, health-wise, both are serious respecters, but the management is not easy. For example, even now, for tobacco, our policy is red light, no smoking. We are reducing it, but ultimately what we want people to smoke. Alcohol, still, I think it should be a red light, but still people have not accepted, neither the policymakers nor the public have accepted that it should be a red light. They think it should be an amber light.
Something they can use and
now even WHO made this mistake, that's why they could not get it included in the FCTC time. WHO also used to say harmless use of alcohol. Only it was 2 years ago that they removed that clause. Now they say there is no harmless limit of alcohol. Minimum is there nothing called minimum safety level. Any alcohol, even a drop, is harmful. So now it's consistent. Now we can manage it that way. Then I became the chair of NATA in 2015, and that also resulted out of a court decision where we were trying during Carlos' time for 2-3 years. They were trying to get this pictorial warnings on the tobacco packets. Yes. We had proposed 80%, but the tobacco company went to court, and in the first round, the Supreme Court at that time, they got the best lawyers in town, and Supreme Court brought it down and said you can use up to 50%, maximum 60%. That's all. But we had a lot of conditions, change every 6 months, different panel of things, and the NATA gives the picture, etc. But we were not happy with that. Most countries had gone to at least 70%. So ours, for the court to say 50%, it's neither here nor there, no. Either is a good thing or not a good thing. So what we did was, it dragged on for about a year and a half. Mr. Maithripala Sirisena was Minister of Health at the time. We managed to convince him that we should somehow do this. So what happened was, we brought a new bill, an amendment to the bill saying pictorial warning should cover 80%. Once the bill comes, then the company has no say in that. So now we have 80%, both sides, 80% with pictorial warnings to be changed every 6 months, and NATA to decide what the pictures are. Then along with that, of course, the tobacco, our NATA Act includes issues like no advertising of any kind. Now we have a problem with advertising because at that time we didn't have electronic advertising, this, what we call this, social media and all, we didn't have that at the time. So now there's a little problem, so that we have to handle, but nothing, you don't see any picture of, now people like you probably did not see it. I grew up in a country, in a Colombo, where practically every street corner there was a huge tobacco advertisement. Yeah. And we have this person called the Marlboro Man everywhere.
Smoking. And even the cricket matches.
Yeah, all sponsored, and you could not go anywhere.
I can remember Wills.
Wills. That is the British American tobacco, one of their big brands, Wills. Yeah. You couldn't go anywhere, everywhere. Different brands, all over. Now this Marlboro Man is an interesting one. Marlboro Man, when I was working in Delhi, after the FCTC was done, he got cancer, kidney cancer, and lung cancer. Okay. And he went around saying, I got this because I was smoking. I was paid to smoke. So he became a good advertisement. Marlboro, and man ultimately died. He died of lung cancer. So that was that time. Now, so no advertising. Then no
sponsoring events or something.
Companies could not sponsor events. Then there were serious restrictions about where people would smoke. Closed spaces you could not do. You could only, even now the rule is like that, only if you have a restaurant which has 30 places or more, you might be able to give a corner for people to smoke. Hotels also, if it has 30 rooms, you can have limited smoking inside the room, which I think both are wrong. But because the tussle was going on with the tobacco company and
also tourism also.
And the tourist board, you're very right, you are very right. In fact, tourist board, still we have problems. When we are talking about alcohol, tourist board is interfering more than the tobacco company.
Yes.
So I was telling these guys at one meeting, I don't think people come to Sri Lanka to go to a corner and drink, no. You can't, that can't be the only attraction to come to Sri Lanka. So no, there is no doctor, we must have a little bit even, in the evening there. So you have to make some concessions until people are convinced that they don't want to do that. So all those things we went through. So now then the other side of that is, what is the effect? What did we do because of it? Now I was doing a little work for a lecture I gave about a month ago. At the time the NATA was being formulated, Sri Lanka had a smoking rate of about 37-38%. Adult over 15. Women, very small, 2% or less. This smoking tobacco, not chewing, not betel chewing. But now, when I took over, the smoking was down to about 24%, 25% adult smoking. We did a survey of the national survey, including Jaffna, 8,000 households. We did a national survey, adult tobacco survey, about 2 years ago, done by the Census and Statistics, who do these big. They are good in big surveys, and our survey gave a result of 9.5% overall, very under 10. At the same time, or 3 months later, the Ministry of Health did what they call the STEP survey, which is for it includes tobacco, alcohol, and food, and lifestyle and all these things. It came to about 12%. So anyway, whether it is 10%, 9%, or 13% is significant in terms of number, but it has come down to a level. So we were saying in 2015, when I took over, I said, if we can get the adult prevalence of tobacco use, not smoking only, tobacco use below 10, then we can say we have eliminated tobacco as a public health problem. But we are not there yet. We can get there, but we are not there, exactly not there yet. But we are in the correct direction. Now, what has happened since then? The time I finished in 2022, or 2023, I finished. We are halfway through COVID. Ministers changed and they wanted to sort of get their own people in, which are very good, and I had wanted to take a break anyway. Now, 2-3 things that we need to do, which we identified at that time. One problem we have is that, before that I'll tell you about some of the other things that we did. We started this thing called the tobacco-free zones. Some little towns where there is no tobacco, no sale, no spray, no nothing. And the first one started in a place called Hakmana. There was a very good MOH and a PHI who, the whole Hakmana town was tobacco free. Now we got the idea, maybe, and that worked. But to do that, you have to get the support of the people. Not only the traders. Traders also, you can put pressure. The tobacco company was fighting us. They were bringing a 3-wheeler selling when nothing was selling in this town, but police did not allow that. You can't sell cigarettes out of a 3-wheeler, no. You have a license, no. You have a trading license. So Hakmana succeeded. From Hakmana, this MOH and team, they started in a place called Walasmulla, both down south. And Hakmana still is tobacco free.
No shops having cigarettes.
No. Then I took as a challenge, I took my area, Alavur, near Kurunagala, where I come from. I got over a nice PHI, gave him a little boost, gave him a little support, and he stopped Alavur, big town, about 30,000 people in that town. He managed to get all the shops except one. One shop which could not do what, he happened to be the agent. But tobacco agent had a problem because he couldn't sell his own town. So he had to take it out. So he was trying very hard to persuade the PHI to go easy. But this guy was very, very good. He's still there. So one day, I took another friend of mine. When I went to my house, I dropped 2 people. I got dropped one guy on the one end of the town. It's a long town, about half a mile long, and then other side I dropped the other guy, gave them money, and said, buy a packet of cigarettes and come. We'll meet halfway. Do you know that just testing,
sampling, and
to assessment of the outcome. They came and said, sir, no cigarettes. No, they don't sell cigarettes here. Now I don't know. The last two years I don't know because I have not been following this very much. But as a result of which, those 2 examples, we started 120 tobacco-free zones in Jaffna also. One of your Jaffna PHs, I know, somewhere close to somewhere there. Yeah. The PHI is very good.
MOH also, I think that
Nandakumar's time. Nandakumar is now in Nandakumar is now here, no?
He's coming for training.
No, he's at the
No, that's not that to Nanda Kumar. He's a director, administrative.
Yeah.
Moj Nanda Kumar is there. I think so.
shortish guy. Short guy.
Yeah, short guy, but this one.
I know this guy goes on a wheelchair. Oh yeah. I remember that Nanda Kumar. Yeah.
He's the one fighting for alcohol free and.
He's doing that. He's still the most there.
Yes.
So Jaffna was also very good. So but now of course, it's like same story. Like you have these dogs in the dogs coming to different places in towns and all. You get rid of a few
stray dogs.
You get rid of a few. Other people come to take the place now. So same, there are other people trying to get in there.
Yeah.
And the tobacco company use different people to start selling cigarettes in these places. And now of course I think Alawa is not entirely tobacco free. Many places, but anyway we got the message.
Yes.
We got the message.
Yes, sir. That's what I think. We need to think. You have success stories. It's not only with the Ministry of Health. Definitely, we need other intersectoral collaboration.
Absolutely.
Interministerial platforms to be established.
Absolutely. And
legislative safeguards.
The people who are most responsible for many of the accomplishments of NATA, number one are the PHIs. Number two are the few good police people.
The inverted comma, good policemen.
I mean, I don't want to go into that detail, but anyway, there are some people who are very supportive. When this tobacco company tried to influence in different ways, they stood their ground. And not only small level people, DIGs. And if you want me to mention a few names who help, this he's a Deputy Inspector General now in Kurunegala, called Ajit Rohana. He was on the NATA board. He did a lot of work for us.
Mr. a media spokesman?
Yeah, he's a lawyer. He went to a number of tobacco conferences when he was with NATA. He became a strong supporter and he had his set of slides and a computer ready to go. And when a person like Ajit Rohana goes, well-known person, to talk to policemen, it has a great effect. Then we had another very good police officer who was in NATA called Sajiva Madhavat. He is now the DIG in charge of Colombo. In fact, from NATA, he moved on to these hard drugs. So we had a lot of support from the police. And like you say, the other sectors, schools to a large extent,
yes.
Education Ministry and the Social Service Department.
Media is another.
Media very important. In fact, media is something that we use all the time. Even now, I also happen to be the chairman of ADIC, this organizer which is doing this information for tobacco and alcohol. We use the media mainly, and we have a good network of media people.
And also trades and also tourism board.
They are very good, but hard to catch guys because they are promoting their agendas now. Yeah. So problem at the time I left, we had made 2-3 major proposals on the basis of experience, Dinesh, which still they are on the table, and I will say how we got there. One is Sri Lanka is one of the few countries now which sells single cigarettes.
Yes, I think now we have stopped that. I think packets should be.
Not yet.
Yeah.
Now, when you say single cigarettes, the two things happen. One is it makes it cheap for children, poor people to smoke. Number two, having the pictorial warning is useless because the Mudrali puts the thing in his drawer and then pulls the cigarette out and gives. So having that is. Now we had a meeting with the Parliament. I am on the board of NATA. I am on the NATA board, so I still keep active with the health sectoral oversight committee, where the current chairman is a doctor who is working in WHO called Nihal Abeykoon. So that's boss.
Yeah, he's a parliamentary.
Yeah, he's chairman of the sectoral committee on health. It's only parliamentary sectoral committee on. So we had, and there are some other very good people, other MPs, about 10 MPs there, both government and opposition. So I made a strong case for this, that we have been trying this. One thing is taxation, which is a big issue. Second is this one. Taxation, we are still, when I was there, I had Rajit Senratne as a Minister of Health, and Sri Lanka increased the taxation to 78% of the cost. That is the highest. Normally WHO, our prescription is it must be 70%, 78%. So Sri Lanka was like the poster boy. No other country in the world had increased it to 78%. Right. Rajendra was being invited to all the countries, etc., to see how Sri Lanka managed to do that. But still, we were not very successful. Even with the 78%, what was happening was government was getting some revenue, but the tobacco company was increasing its profit. Because in Sri Lanka, the practice is the tobacco company fixes the price, not the government. Most other things, government says no, fixed price, 120. In cigarettes, tobacco, the company fixes the price. So what they do is, if the tax is 78%, let us say, then it comes to 120 rupees per cigarette. Company will add, now it's 2 rupees their profit, they'll add, make it 5. So although the smoking rate has gone down, the profits of the tobacco company have gone up. For example, the time I was in NATA, we had 5.2 billion sales of cigarettes per year, 5.2 billion. Now it's less than 3 billion. But
profits are high.
Profit of the tobacco companies, well, how does it work? That means two things. One is the fact that they have fixed a price. If one is going down and the decrease in the prevalence of tobacco use has not gone to the extent of balancing it. Mainly because tobacco cigarettes are still affordable.
Yes.
If they do these two things, one is stop selling cigarettes, the consumption will go down a lot because school children and all will not afford, and it's not an easy thing to collect 5 people getting together and collecting how much? 165 into 20 is about 3,500 rupees, no? So it's not easy for a schoolboy to pay 3,500, and how can you collect money and smoke one cigarette? So immediately the consumption will go down. And the poor people, the consumption, so the tobacco company's argument is, no, if you do that, BD will go up. That's not the problem. BD are not gone up. Tobacco company's response is not BD. They produce a very cheap cigarette. Now they are producing a cigarette for 38 rupees. Called Capstan.
Poor quality and more harmful.
More harmful, cheaper. And it's unlikely, Dinesh, that a person who's seen smoking a cigarette would like to be seen smoking a BD on the road. There's a status thing now.
Yes.
I mean,
cigarette is that's more harmful because it's status.
Yeah. So someone who smokes a cigarette to be seen smoking BD, his status has gone down beyond recognition. So no one will do that. So the tobacco company knows that. Therefore, as an alternative, they have produced cheaper cigarettes. But if we tax it a little bit more, government will get more money, the consumption of tobacco will go down. The other problem that is slowly coming up, I was reading the tobacco company report last night, before you came. They are promoting 3 electronic cigarettes.
Oh yeah, one of the questions I also have that for the e-cigarettes and.
Fortunately, in 2017 September, we got a regulation banning e-cigarettes in Sri Lanka.
Still not, yeah.
It's still banned.
Yeah.
But people there's smuggling going on. But e-cigarettes, Dinesh, I don't think Sri Lanka it will be a popular thing in Sri Lanka because it's quite expensive. It will be a fashionable thing in the Colombo society, rich children, international schools and big schools. There may be children who, for fashion, will do that. But I don't think it will catch up as a popular event. No, it won't be a popular event.
So what about the BD? I think I have seen in Jaffna also the manual laborers and the people. Now they move to this BD because of this price escalation.
People who smoke cigarettes.
Cigarettes are there. I have seen.
I mean, guys who were smoking cigarettes are now smoking BD in Jaffna.
Yes.
Very interesting you say that. Said BD may be happening, they may be, but it's not an increase because we know that BD consumption in Sri Lanka has not increased. In fact, it has gone down because BD is wrapped in a leaf called the tendu leaf. which comes from a certain district of Tamil Nadu.
Yeah.
And unless they smuggle, the import of tender leaf has actually not gone up. It is stable.
But that's the thing, I also worry about the smuggling through South India.
That I don't know how much is coming through. Maybe Jaffna they're getting more. Yeah. Because from every kilogram of tender leaf, you can produce 2,500 BDs. So if you take the calculation like that, the numbers have not gone up. And I know the candy guys in Marwanagoda who make the tobacco, they are BD, they are very famous guys. They say no, the sales have not gone up. It's become a cottage industry. Women in the villages are wrapping it, but the numbers have not gone up.
I think we need to search for the things